Our vision is a world in which cancer recurrence is no longer. No more déjà vu for cancer patients. Our mission is to build a disruptive discovery and development engine for cures that will ensure patients that their cancer never returns as a metastasis. Cancer recurrence is the main source of death, fear, and suffering among millions of cancer patients and their loved ones. 90% of cancer deaths are caused by drug-resistant recurring metastatic cancer tumors. Only 10% of people who die from cancer actually die from their primary tumor. Unfortunately, the current options to control metastasis and cancer recurrence are devastatingly limited. The problem is, cancer recurrence can happen years, even decades after treatment of the primary tumor. Some primary tumor cells, which are non-dividing, resist therapies given at the time of the initial treatment. These cells from the primary tumor may travel to distant organs early, enter, and remain in a long-term dormant state until they awaken. This is the main reason why these three words, "you have cancer," are three of the most terrifying words you can ever hear. Early detection, removal, or treatment of the primary tumor can be effective in many cases. Yet for most cancer patients, the greatest fear and concern is that one day the cancer will return. Vuja Day's solution is to address dormant cancer cells long before they can form deadly metastases. Dormant tumor cells are present long enough to be controlled, either by drugs that target such cells for elimination or low-toxicity drugs that maintain them in a dormant state. It's also likely that common mechanisms for dormancy exists across many cancer types, namely interaction of cancer cells with the suppressive normal extracellular matrix, which could lead to drugs that are effective in controlling recurrence in multiple cancer types. To develop such drugs, Vuja Day is utilizing a multidimensional approach to drug discovery. Our unique platform technology includes two novel systems that enable us to screen hundreds of thousands of compounds and to identify those specific compounds that can potentially control dormancy. Several first-generation compounds have been identified using our platform and validated in our animal cancer models where they prevented formation of deadly metastases. These lead compounds will be chemically modified and optimized for therapeutic potency and efficacy, and additional leads will be sought. We're also taking a complementary approach that leverages our understanding of the molecular mechanisms of dormancy, aided by our experience with cutting-edge computational biology, to identify compounds that have the potential to control dormancy. Using these approaches, we'll identify many more drug candidates and offer them in clinical trials to cancer patients who have a high likelihood of early metastasis and later to additional cancer patients. Drugs that can halt or reduce metastasis across one type of cancer and potentially many and all cancers can help many millions of people around the world. Even at a relatively low cost compared to many current treatments of $10,000 a year per patient, such drugs would have a potential to reach $100 billion in annual sales. This drives the economic incentive to invest in the discovery and development of dormancy-targeting therapies. We at Vuja Day strive to do something extraordinary, something unfamiliar. Short extension of the lives of cancer patients or helping only a small portion of patients is not enough. By focusing on dormant cancer cells long before they can form deadly metastases, Vuja Day's success will disrupt cancer treatment, create enormous relief for patients and their loved ones, and generate tremendous economic value.